Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This show is a resource of the Association of Community Cancer Centers, developed to bring oncology professionals the news and the latest trends in cancer care. Today, barriers to genetic counseling and testing for patients with cancer, especially in a telehealth setting. Our guest today is Katie Lemas, a certified genetic counselor at Genome Medical. Katie, welcome, and thank you for diving into this topic with us.
Hi, Summer. Thank you for having me. I'm excited to share some information today.
Let's get right to it. Katie, even though we know that genetic testing early in diagnosis can help make decisions about how to best treat cancer, some recent studies cite lack of initial referral to genetic counseling as the most significant barrier to utilization, as is timeliness. What can providers do to help improve utilization?
Yeah, so I think that there are a number of things that providers can do. And one that I think is really important is just really communicating with patients the importance of this genetic information. I know that many patients are very conscious of kind of what their providers are saying and the information that they find important. And so really communicating the importance and how the genetic information is going to impact care can be really helpful for these patients.
What are the benefits of testing sooner rather than later?
So I think that there's a number of benefits. So one, we know that more and more these genetic test results can be used in making treatment decisions. So whether that be an initial diagnosis and helping with surgical decisions, whether it be kind of down the road and maybe a metastatic setting where we're looking for different treatments and genetic results can be used in making some of those decisions. So definitely treatment decision making, this comes into play. I think also just having this information, and a big piece of this for patients is information for family members, and kind of the sooner that information can be shared, that can also be beneficial for not only the patient, but for family members and even potentially preventing a cancer in the future.
Walk us through what that patient experience is like, especially receiving genetic counseling services via telehealth. At what stage is the genetic counselor actually interacting with the patient and the provider?
Yeah, so typically the way the process works is that a patient would be referred for genetic counseling. This can happen, either from a physician, or patients sometimes even can self-refer for genetic counseling. We would meet with the patient and discuss their personal and family history information to help kind of build a differential of potential hereditary cancer syndromes that could be impacting that patient. We talk with patients about the different genetic testing options. That's something that definitely has grown over time. Now we're not looking just at single genes, but typically looking at several different genes at one time. So kind of explaining those options, different lab choices. We'll talk with patients about the logistics of testing. So how to get the sample collected, whether that's a blood sample or a saliva sample. We can help to discuss financial concerns, so cost of testing, insurance coverage, financial assistance options that might be available for those patients, and then help just to facilitate the decision making by the patient on kind of what the most appropriate test would be. And once those results are back, I think that's really where that communication, again with the patient, but then with providers, we tend to have more of that communication once those results are back, just in interpreting whatever those results are, whether it's a positive, negative, a variant of uncertain significance, and how that could impact patient care going forward.
In your experience, why do patients not follow through with genetic testing? And how can care teams on that side better engage to help with that follow through?
Yeah, so I think there's a number of different reasons that patients may not follow through. One, I think for some patients who maybe are dealing with more kind of more pressing disease, so maybe a metastatic diagnosis or like pancreatic cancer where there's a lot of morbidity related with the disease, they just are really overwhelmed. And genetic counseling, genetic testing is kind of one more thing that they have to do in a situation where they're already very overwhelmed, very scared. So, in that situation, I think that providers, again, just talking about how that information is critical for making some of those treatment decisions is really important. I think even just giving them kind of a 30-second rundown of these are the things that you'll be talking about, just so maybe they're more aware and know what to expect, and so aren't quite as overwhelmed with another kind of appointment or another process that they have to go through. I think another kind of area where we see patient dropout is just in concern about finances of testing, so cost, insurance coverage. And this used to be, I think, a much larger issue than it is now. And I think it still is kind of a common misconception that genetic testing is thousands of dollars and insurance doesn't cover it. And really now insurance coverage is much better than it used to be. And so there are many patients that do have insurance coverage for testing. The cost of testing has come way down. So now there are many tests that can be done for only a few $100s. And there are a lot of financial assistance options available, whether through laboratories or other organizations. And that's something that as genetic counselors, we really can help patients to navigate. So I always say, don't let cost be the reason that you're not following through with genetic counseling and testing, because there are a lot of resources out there that we can help out with.
Thinking about newly diagnosed patients, and back to what you just said, there's a lot going on in their mind, and sometimes there's a high morbidity associated with what they've just been diagnosed. Let's take, for example, a patient who's just been diagnosed with metastatic breast cancer. They're absorbing all that information. How can you communicate the importance of genetic testing to patients so they better understand their cancer and treatment planning?
Yeah. So I think that, oftentimes when they're hearing this news, a couple of things that really can help to just underscore the importance is talking about how there are different options going forward in terms of treatment and wanting to have kind of the most information available to make the most informed decisions about treatment. One of those pieces of information is genetic testing. And I think, even using like as an example, we have imaging that we use. So maybe, we need a PET scan or CT scan to have all of the information, a biopsy. Genetic testing is really just another piece of information, just like any one of these other tests that would be, routinely recommended for individuals. So just letting them know that, this is information that would be helpful to the provider to make that most informed decision to find that treatment that's going to be the most beneficial for them. I think, another piece that sometimes is not thought about as much because it's not necessarily impacting that treatment in that moment, but having that information for other family members. And I find that many people, the majority of people that are coming in for genetic counseling and genetic testing, when you talk about how this information not only helps them, but can help many other family members, children, grandchildren, siblings, cousins, extended family members. And I find that many patients, are in that situation and don't want any of their other family members to have to face that same type of diagnosis. And so having that information and letting them know that not only is this helping them to find the best treatment at that point, but also that this is going to be information that will be helpful for other family members is really a big motivating factor for many patients.
Can you talk about the intersection of genetic testing and clinical trials for cancer?
Yeah. So now I think that precision medicine is really kind of where a lot of oncology care is headed. And for many of those new treatments, one of the main components is a person's genetic makeup. And so genetic testing, not only somatic testing of the tissue itself, but this germline testing that we're doing with patients is being used to help find these targeted therapies that really are most effective for these patients. And so for many clinical trials, genetic testing is kind of part of the inclusion criteria. A person who has maybe a specific genetic marker would make them eligible for certain clinical trials. And so having that genetic test result information definitely can help to determine if there are any clinical trials that that patient could participate in now or in the future, because these genetic test results don't really change over time. So I think going back to one of your earlier questions about timeliness of this, the sooner we have that information, the more opportunities that that patient could potentially have going forward based on those markers.
Last question. What does the care team need to know right now about working with genetic counselors, especially in telehealth?
Yeah. So I think that we are here to help you. We're here to help patients. I think we definitely are an integral part of the care team. Even with telemedicine, I think over the last year and a half, we've seen how beneficial that can be for patients. And even prior to the pandemic, I think that this just really helps. Telemedicine helps to provide access to care to patients that maybe would not otherwise be able to easily access a genetic counselor. I think that many genetic counselors really are located in larger metropolitan areas or at academic medical centers. And so telemedicine through different providers really can help to bring access to patients all over the country and help them to be able to utilize all of this information the same way people in a large city could.
Thank you, Katie. This is really important work. Thank you for your time today.
Thank you.
For more resources on the topic today, you can check out the show notes or you can head over to the ACCC website at accc-cancer.org. Also, you might want to check out the Cancer Buzz audio podcast channel. You can listen to even more programming on the latest in cancer care as you drive to work, cook dinner, or walk the dog. Just search for Cancer Buzz on your favorite podcast app. On behalf of all of us here at Cancer Buzz TV, thank you for watching. I'm Summer Johnson.